name is Brittany, and I'm a victim of wrong site surgery. I came in for a left carpal tunnel and amputated my right arm. A wrong site surgery can be a procedure that's performed on the wrong person. It could be the wrong procedure on the wrong extremity, or the procedure could just be more invasive than originally planned. There are many ways this could have been prevented. They could have done a timeout right before the procedure. The surgeon could have come and initialed my extremity so they knew which one they were operating on. Or they could have reviewed the consent with me. Wrong site surgeries are becoming less and less with these interventions. However, each hospital, on average, has one every 5 to 10 years.
My name is Sissy, and I've recently been injured due to a fall. A fall is a sudden, unintentional change in position after coming to a rest on the ground or a lower level. After my pain medication started working, I attempted to go to the restroom and overestimated myself and fell.
Although not all falls result in harm, some result in the patient's death. Each patient should be evaluated routinely and independently for their fall risk. Not all strategies work for everyone, so strategies should be patient-specific. Lastly, education to the patient and family is very critical in reducing falls.
Hello, I'm Loretta. I was sick and I left the hospital a week ago, and here I am again. When I told the nurses that I wasn't feeling too good to go home, I wasn't strong enough, they assured me that I will be fine. So here I am again. Anyways, a readmission is when a patient comes back to the hospital within 30 days after discharge.
My name is Linda. And there are many preventative measures that are being implemented to help support patients upon discharge, or rather after discharge. These implementations include referral to home care, follow-up appointments, transfer to subacute care, and rehab facilities.
I'm Brandy, and I've developed a hospital-acquired infection. A hospital-acquired infection is an infection that occurs during hospital care that was not present or incubating at admission. Infections occurring more than 48 hours after admission are typically considered to be nosocomial. I had surgery over a month ago, and the recovery was only supposed to take a couple of days.
There are many ways that we could have prevented this. Some of the methods to reduce the risk for infection are minimizing invasive procedures, the use of antimicrobials, vaccinations, and identifying people at risk. The most important and effective thing I could do to prevent this is to simply wash my hands.
2, 3. My name is Gina, and I've just been given a medication I'm allergic to. In a few minutes, I will begin to have an allergic reaction. This is just one of the many types of medication errors. A medication error is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is controlled of the health professional, the patient, or the consumer.
Seriousness of medication errors varies on the particular situation, and it can be fatal. As a nurse, there are ways that I can prevent this from happening. They are the 3 checks and 5 rights. Use the barcode scanning system. Use the no interruption zones or vests when pulling the medications. And the last would be identifying the patient and the patient's medication allergies.
Hi, my name is Amy, and a diagnostic error is about to cost me my life. A diagnostic error is something that is wronged or delayed, missed by some subsequent definitive testing. The doctors and nurses have missed what is about to lead to my demise.
Diagnostic errors can have minimal effects, but they can also be fatal, as in her case. Usually they involve more than one healthcare professional and can be prevented by ensuring complete and accurate assessments, getting someone to review the tests, doing more subsequent diagnostic tests, and most importantly, listening to the patient and their families.
Sorry, Amy.
For infection or minimize the risk for infection or minimizing invasive procedures. For some reason, I can't.
Minimizing invasive procedures.
No, not wronged. It is wronged.
And I will begin to start over.
Barcode scanning.
Tell me when it's rolling.
It's rolling.